Hello and welcome. Thank you for joining our session today on cross-training of staff in safe client handling, ensuring continuity of care. Today we will be focusing on Sling Basics. We will cover topics ranging from how to select a sling through to sling application tips and tricks. We have assembled resources that are both easy to use and easily accessible to enable you to create a toolkit for your facility training needs. Let's get a general sense of your comfort level with slings. On a scale of 0 to 5, how comfortable are you with slings? Please put your response in the chat window. It will give us a sense today of your comfort level with slings. It's our hope that we can increase your comfort level by the end of this session. Feel free to chat with us or ask questions throughout the session in the chat window, and we'll be more than happy to assist you. When reflecting on this year's conference theme, COVID-19, What Set BC Apart, it became clearly evident that one of the risk management strategies BC implemented was to focus on human resources. By supporting staff financially and limiting their movement between sites, I believe this action helped to contain the spread of the virus in long-term care. Focusing on a human resource strategy is in line with the healthcare sector guidance resource provided by the Government of Canada. And as such, as we continue to plan and prepare for the possible upcoming waves, we still need to continue to focus on our human resource strategies. During the first wave of the pandemic, you may have witnessed colleagues who became sick, quit, burnt out, and/or sustained injuries as they tried to manage resident care. Staffing was and still is a challenge in healthcare. Residents need to be lifted, transferred, repositioned, and supported, and it needs to be done safely in order to mitigate injuries to caregivers, decrease the risk of resident falls, prevent and manage pressure injuries, and maintain and/or improve resident function. During these uncertain times, we need all hands on deck. We need to continue preparing and training all staff and possibly volunteers to be able to safely use safe patient handling and mobility devices such as slings to provide safe, quality care to residents. Let's begin by discussing how to choose a sling. When selecting a sling for residents, the task can sometimes feel overwhelming with so many styles, sizes, and fabrics to choose from. Today, I will walk you through a step-by-step process on how to choose a sling. This process will group and sort information, helping to narrow down the available sling options, with the goal of ultimately helping you to select an appropriate sling for your resident. The first step in the sling selection process begins with a thorough initial assessment of the resident, typically performed by a healthcare professional. This is called the resident situation. The initial assessment of the resident will give the healthcare professional an overall picture of the resident's needs and abilities. During the initial assessment, the healthcare professional will perform a mobility assessment and determine if the resident is independent with their transfers, whether they require supervision or queuing with transfers, whether they require a 1 to 2 person assist with transfers, or whether the resident is partially weight-bearing and may require a sit-to-stand lift and sling, or if the resident is non-weight-bearing and require a floor or ceiling lift and sling to safely transfer from one location to another. The mobility assessment begins to narrow down the sling style options, as there are different sling styles to perform transfers safely for residents who are weight-bearing, partially weight-bearing, or non-weight-bearing. If the healthcare professional decides the resident requires a lift and sling to safely transfer, then the resident's height, weight, and/or waist circumference measurements will be required to select the correct sling size. Assessing for residents' behavior and cognition will also factor into your choice of a safe patient handling and mobility solution. For example, if a resident is partially weight-bearing, the healthcare professional might consider a motorized sit-to-stand lift with a stand aid sling. But if the resident is combative or not able to follow directions or not predictable, then the resident would not be able to safely use the safe patient handling and mobility solution. They would no longer be a candidate for a sit-to-stand lift and sling. The healthcare professional may then need to consider and decide if a floor or ceiling lift with a sling is a safer option for the resident's transfer. Assessing the resident's skin integrity may guide the sling fabric selection process. For example, if skin integrity is an issue, a spacer fabric, which is a comfortable, smooth, knitted polyester fabric with an internal air gap that is breathable, wicks away moisture, and has a multi-directional stretch, may be selected for a sling over a mesh fabric with its multiple pressure points that may irritate and further compromise skin integrity. With all the information collected during the initial assessment, including the signs and symptoms of medical conditions, medications, precautions, contraindications, and so on, the healthcare professional will determine how this information will impact the resident's lift and transfer needs. Step 2 in the sling selection process is determining the resident's lift situation. This information is gathered during the initial assessment of the resident performed by the healthcare professional. The lift situation is a list of the types of lifts and transfers the resident requires. Often the resident requires more than one type of lift or transfer, and you may require more than one type of sling style to meet the resident's needs. The initial assessment of the resident may reveal that the resident needs to be transferred from bed to wheelchair, and to the commode, and to the tub, and they may also need assistance with repositioning in bed. The healthcare professional will determine how much assistance the resident requires for each lift situation. This will help to narrow down the sling style options. For example, a resident who needs to be transferred from a bed to a wheelchair. What abilities do they have? If the resident is able to weight bear, but requires caregiver assistance with the transfer due to balance issues, then a standing or walking sling with a lift may be a suitable option. If the resident is partially weight bearing, then a motorized sit-to-stand lift and a stand-aid sling may be a possibility. If the resident is non-weight bearing and needs to transfer from the bed to the wheelchair, then a seated transfer sling with either a floor or ceiling lift may be the solution of choice. The healthcare professional will decide which option is safest for the resident. What about a non-weight bearing resident who requires a transfer to the toilet or commode? At this point, the healthcare professional will determine which sling, for example, the Hygiene sling or the universal sling, is most appropriate and safest for the resident to use. And for the resident who requires assistance with repositioning or turning in bed, the healthcare professional will assess and determine if a positioning sling or a tri-turner sling would be beneficial for the resident and caregiver in this situation. In choosing a sling option, both the resident's needs and abilities from the initial assessment and the lift situation need to be considered. Let's have a look at a handy tool to help visualize the different lift situations and the possible sling options. On screen is a simple, handy lift grid tool which allows caregivers to quickly visualize what sling style options are available for different lift situations. It's simple to use. Let's pick a lift situation. For example, if you need to support a resident's limb, your sling choice would be simple. The sling option for limb lifting is the band sling. From this point, you would choose the band sling size and fabric. Or if you need to transfer a resident onto a commode, you will find you have a variety of sling options to choose from. The information collected during the resident's initial assessment will help to narrow down the sling style. For example, if the resident is weight bearing, then a standing sling or a Rehab total support sling could be an option. If the resident is partially weight bearing, a stand-aid sling with a motorized sit-to-stand lift may be selected. If the resident is non-weight bearing, the options include all the seated transfer slings, the universal, the deluxe hammock, the comfort care, and you also have the Hygiene or the dual axis sling. All these slings have a commode opening. The healthcare professional will then determine which sling style will provide the resident with the appropriate amount of support based on the resident's needs and abilities. This handy lift grid resource can easily be added to your facility training toolkit to help caregivers quickly learn about and visualize the different sling style options that are available for the various resident lift and transfer situations. Step 3 in the sling selection process is to select a sling style that meets the resident's needs and abilities for a particular lift situation. Generally speaking, sling styles can be broken down into several groups. The seated transfer slings are multi-purpose slings that can be used with a floor or ceiling lift, with residents who are non-weight bearing, require a seated transfer, and are able to maintain a seated position. These slings are not used, for example, with users who have unstable spinal fractures. The hygiene slings were specifically designed for hygiene and toileting functions. Sit-to-stand slings are used with motorized sit-to-stand lifts and can be used for partially weight-bearing residents if deemed appropriate by the healthcare professional. Some sit-to-stand slings have loop straps and others have clip straps. Ensure you use the correct equipment, clip to clip and loop to loop. Positioning slings are used for different tasks such as repositioning in bed, lateral transfers, turning, or supporting a limb. They were designed to address the risk of musculoskeletal injuries associated with these tasks. And standing and walking slings are used with some floor and ceiling lifts for transfers, gait training, and for fall prevention programs. Within the seated transfer sling group, there are a variety of styles. We call these slings the universal sling, the deluxe hammock, and the comfort care sling. These multi-purpose seated transfer slings offer varying degrees of support to meet the varying needs and abilities of residents. On screen, you can quickly visualize the amount of support offered by each sling. The deluxe hammock will provide greater support around the sacral, hip, and thigh areas in comparison to the universal sling. If the resident required even greater support than what the deluxe hammock or the universal sling could provide, then the healthcare professional could consider the hammock or the comfort care sling. This handy resource can be added to your facility training toolkit to help caregivers learn to quickly visualize the different levels of support these sling styles provide. Next, understanding the anatomy, the functions and features of the sling will assist with the sling selection process. Here is an example of the anatomy of the universal sling. The universal sling, which is the most commonly used seated transfer sling, is easily identified by its inverted U shape. This sling is available with or without head support. The head support provides the resident with head and neck support during the lift and transfer. This is recommended for residents who lack head and neck control, or for residents who may fatigue quickly or are unpredictable, or for lifting and transferring a resident from a supine position or from the floor. The body of the sling will support the resident posteriorly around the back and laterally along the sides. You will want to ensure the sling you choose provides enough support laterally when performing the lift and transfer. If the sling is too small, it might not provide enough support laterally, and it may also feel tight and uncomfortable for the resident. If the sling is too large, you may not achieve a balanced and supportive sling fit, and may find it difficult to achieve an upright seated position. The leg bands support around the hips and under the thighs. The leg bands can be applied in a crisscrossed, open, or closed application. The selection of leg band application will be based on the resident's needs and abilities. When applying the leg bands, ensure they are smooth and flat and not bunching to prevent resident discomfort under the thighs. The center arch is the point used for sling landmarking during sling application. The center arch is typically placed at the level of the resident's coccyx. The commode opening is located between the leg bands. The commode opening ranges in size depending on the sling style. The universal sling has a medium-sized commode opening, and the hammock has a small-sized commode opening, and the comfort care is available with or without a commode opening. Ensure the resident is well supported in the sling and does not migrate through the commode opening. The sling straps are used to secure the sling to the carry bar for the lift and transfer. Depending on the sling, the number of straps may vary. Within the straps are colored loops. The loops are attached to the lift carry bar. The loop choice will determine the seated position of the resident. For example, if you use the shortest loop at the shoulder strap and the longest loop at the leg strap, the resident will be in a seated position. If you use the longest loop at the shoulder and the longest at the legs, you will have the resident in a more reclined position. The handles on the posterior aspect of the sling helps caregivers to maneuver the resident into position. Ensure you do not pull forcefully and quickly on the handles, as the resident may lose their seated position. The border trim around the sling or along the center of the sling back helps to identify the size of the sling. For example, a red border around the sling indicates the sling is a small size, a yellow border indicates the sling is a medium sling size, and the green border trim indicates the sling is large in size. The sling size is also located on the label of the sling. The label is an important safety feature for caregivers, as they may not be familiar with the color-coded size border trim and will need to rely on the sling label to inform them of the sling size. The sling label located posteriorly on the sling includes important information that allows the sling to be easily identified. The label will provide the sling style, size, and safe working load. Ensure you are familiar with the safe working load of your sling and that you do not exceed the limit. The label will also provide laundry instructions and a sling serial number. Slings with missing labels or illegible labels should not be used and removed from circulation for safety. Follow your facility's policies and procedures with regards to removing a sling from circulation when it has failed an inspection. Here are examples of possible leg band applications. There's the closed leg band application, the open leg band application, and the crisscrossed application. The crisscrossed application is the most commonly used leg band application. The healthcare professional will select the appropriate leg band application for the resident. On screen is the anatomy of the deluxe hammock. The deluxe hammock is a hybrid of the universal and hammock sling. This sling is used for residents who require greater support than the universal sling provides. Residents who have experienced discomfort with the universal sling have found the deluxe hammock to be both supportive and comfortable. Some of the key differences between the deluxe hammock and the universal sling include the increased support in and around the sacral, hip, and thigh area, and the smaller commode opening in comparison to the universal sling. The deluxe hammock provides optional head support and is available with either 4 or 6 straps for increased lateral support. This sling also allows for a variety of leg band applications, crisscrossed, closed, and open, and the various straps and loops offer different seated options. This sling is available in a variety of sizes, safe working loads, and fabrics to meet the needs and abilities of different residents. The hammock sling, also known as a split leg style sling, is considered to be both comfortable and supportive. This style of sling may be used with a resident who requires greater support than the universal or deluxe hammock sling can provide. The hammock sling has the ability to support each thigh independently and provides increased support around the sacral, hip, and thigh area. There is a small commode opening which can be used for hygiene and toileting needs. This sling style may be suitable, for example, for residents with above-the-knee amputations, or for residents with limited upper body function and tone, or for residents who need to minimize their hip rotation in a seated sling. The Comfort Care sling differs from the universal, deluxe hammock, and hammock sling in various ways. Firstly, the sling can only be applied and removed in bed. The Comfort Care sling, with its undivided leg supports, was designed to be left in place. The narrow sling design provides a tailored sling fit in the chair, reducing the effects of bunched fabric on the resident when seated on a sling. The removal of the handles posteriorly on the sling also eliminates a potential pressure point when seated on the sling. The sling is available with or without head support to accommodate the various resident needs and abilities, and is available with either 4 or 6 straps for increased resident support. The leg straps can be easily tucked away in the pouch when not in use to limit contact between the straps and the resident's skin. The Comfort Care sling is only available in a spacer fabric, which is breathable, wicks away moisture, and has a pressure redistributing property. The combination of sling design and fabric may make it a suitable leave-in-place sling for residents who, for example, may be experiencing pain or increased pain with the application or removal of a sling, or for residents where it is difficult to place and remove a sling due to weight, body shape, tone, or behavior, or for residents who want the sling to be left in place through the day, or when caregivers want to limit the friction and shearing that occurs with the placement and removal of slings. Or it may be suitable for residents with bilateral above-the-knee amputations. There may be other situations where a leave-in-place sling is considered. Keep in mind the decision to leave a sling in place requires a thorough assessment by a healthcare professional and sound clinical judgment. Once a decision is made to leave a sling in place, continued monitoring of the resident's skin integrity and maintaining a positioning schedule that meets the resident's needs is still required. When working through the sling selection process for the seated transfer slings, a few questions to keep in mind would be: does the resident require head support? Does the resident require a commode opening? If no, the choice is simple. It's the Comfort Care sling, as the commode opening for this particular sling is optional. If, however, you do require a commode opening, you have 4 options: the universal sling, deluxe hammock, and Comfort Care sling. To narrow down the options, what size commode opening will the resident require? A small opening, like the hammock or Comfort Care sling? A small to medium opening, like the deluxe hammock? Or will they require a medium-size opening, like the one found in the universal sling? How much lateral support does the resident need? Again, depending on the sling style you choose, select the number of straps that best suits your resident's needs and abilities. Ultimately, you will want to select a sling that provides the resident with a supportive and comfortable fit. Don't forget to keep in mind the resident's height and weight, which will factor into the sling size. And keep in mind what the resident's skin integrity is like, because this will factor into your choice of sling fabric selection. Now let's look at the Hygiene sling group. Within the Hygiene sling group, you will find the dual access and the Hygiene sling. Both slings are specifically designed for toileting and hygiene functions. The Hygiene and dual access sling can be used with either a floor or ceiling lift. These slings are popular with caregivers because they can be quickly and easily applied, and they provide easy access to clothing for toileting and hygiene needs. When selecting this sling style, caregivers will need to ensure the resident has been assessed by the healthcare professional and that the resident has demonstrated they have sufficient range of motion, strength, and endurance to remain in a seated position throughout the duration of the task. The resident should be able to understand the function of the sling and be comfortable with its use. The resident should also be able to follow directions, be predictable, and non-combative to safely use this sling style. With the anatomy of the Hygiene and dual access slings, it is quickly evident that these slings provide less support than the universal, deluxe hammock, and Comfort Care slings. It is essential that the resident is assessed by a healthcare professional and deemed appropriate to use these slings. Neither the Hygiene nor the dual access sling provides head support. The body of the slings support from the mid to low back and around the torso. The Hygiene sling has either a Velcro or buckle enclosure, and the dual access sling has both the buckle and Velcro enclosure. Both the dual access and Hygiene sling leg bands support under the thighs. The dual access leg bands are padded, and the Hygiene sling leg bands are quilted. The leg bands for both slings are commonly applied in a crisscross application. The commode opening for both slings is large. With these sling styles, it is important to ensure the resident is well supported in the sling and is able to maintain the seated position throughout the duration of the task to prevent migration through the commode opening. Given the decreased support of this sling style, a resident should never be lifted from the floor or from a supine position in this type of sling. Let's recap. When selecting a Hygiene sling style, the healthcare professional will determine via a thorough resident assessment that this sling style is appropriate and supportive enough for the resident to use safely. The next group of slings are called positioning slings. There are three types of slings in this category: the band sling, the tri-turner sling, and the positioning sling. On screen is a shortened video clip of the positioning sling. The full version of the positioning sling video can be easily accessed on the Handicare website for your facility education and training needs. The positioning sling is a full body sling supporting individuals from head to toe. The sling is available in a variety of sizes, fabrics, and safe working loads. The positioning sling has various straps and loops which can be adjusted to meet the resident's needs. This sling can be placed using a log rolling method, used and then removed, or it can be left in place based on the healthcare professional's clinical assessment and judgment. The positioning sling can be used for lateral supine transfers, moving the resident from one bed to another, or moving them onto a stretcher. The sling can also facilitate bed linen changes. It can be used to reposition the residents up the bed or to turn them in bed, to assist caregivers during bathing or dressing of residents, or for the assessment and treatment of pressure injuries. The positioning sling has also been used in the hospital setting for proning of patients for the treatment of COVID-19. This versatile sling eliminates the need to manually reposition, lift, and transfer dependent residents, which may decrease the potential risk of musculoskeletal injuries to both the caregiver and the resident. On screen is a shortened video clip of the tri-turner sling. This video is easily accessible on the Handicare website for facility education and training needs. The tri-turner sling is designed for turning a user in bed. This small hourglass-shaped sling, available in different fabrics and sizes, has 4 attachment points and a sewn-in Velcro strap that attaches the sling to the bed frame to prevent the sling from moving when turning the resident in bed. This sling is typically applied under the resident at the level of the low back and can be used for offloading, or it can provide access for hygiene care, wound care, or dressing of the resident. The tri-turner sling eliminates the need to manually turn residents, which can potentially cause musculoskeletal injuries to both the resident and caregiver. Next on screen, we have a shortened video clip of the band sling. The band sling is designed to address the risk of musculoskeletal injuries with manual limb holding and positioning. This small, versatile sling is comprised of a body, label, and straps, and is available in different sizes and fabrics. The body of the sling supports the resident's extremity. The label of the sling is located posteriorly on the sling, and the straps with various loops are located at each end of the band sling and are attached to the carry bar. The sling is used, for example, to assist with elevating the limb to perform skin inspections, wound care, foot care, dressing, hygiene care. It can also be used to assist with the application of sling leg bands and to perform rehab exercises. The next sling group is the sit-to-stand sling. The stand-aid sling was designed to provide support for transfers, repositioning in a chair, toileting, and sit-to-stand training for partially weight-bearing users based on a risk assessment. This sling provides support from the low back to the mid-back and wraps around the torso with a Velcro and buckle enclosure. The stand-aid sling is only to be used with a powered sit-to-stand lift, like the mini lift as seen on the screen, which accepts this loop-style sling. This sling is available in a polyester fabric with a safe working load of 600 pounds. When deciding on a sling size, you will need to measure the resident's waist circumference for this sling. Lastly, we have the standing and walking slings designed to provide support for fall prevention programs, transfers, standing, and gait training. The full standing support sling offers support around the torso and thighs with quilted fabric and buckle enclosures. This sling is available in a variety of sizes from small to extra large and has a safe working load of 600 pounds. For sizing, the resident's waist circumference will be required. Lastly, the Rehab Total Support System is constructed in a padded polyester fabric for user comfort with a safe working load of 800 pounds. The sling provides support around the torso with dual adjustable Velcro enclosures, with the padded leg harness attached to the torso support via adjustable buckle enclosures. Again, for sizing, the resident's waist circumference will be required. Now that a sling style based on the resident's needs and abilities has been selected, the next step is to choose the sling size. People come in different heights, weights, and body shapes. To pick a sling size, you will need the height and weight, and depending on the sling type, the waist circumference of the resident. An easy-to-use size chart like the ones featured on the screen allow caregivers to quickly choose a sling size. For example, if the resident requires a seated transfer sling and is 5'5" and weighs 200 pounds, then a medium-sized sling would be selected. At times, healthcare providers may find that, given an individual's body shape, they may be uncertain which size would work best. In this case, performing a simple width and length measurement of the resident will be required. To measure width, measure from anterior shoulder around the resident's back posteriorly to the opposite anterior shoulder. To measure length, measure from the resident's coccyx to shoulder height. With these measurements, follow up with your account manager who will be able to assist you in finding an appropriate sling size. Sometimes, if a fit cannot be found, the healthcare professional has the option of having a custom sling created for the resident. This handy size guide resource can be added to your facility training toolkit to help caregivers learn about sling sizing for residents. Next, sling fabric needs to be picked in the sling selection process. Slings will come in a variety of fabrics. The healthcare professional will select a sling fabric based on the needs of the resident. Let's have a look at fabric options, beginning with mesh fabric. Mesh fabric slings are strong, durable, and economical. Mesh is a breathable, quick-drying, easily washable, open-weave polyester material. Mesh slings are sometimes used for bathing but not recommended for individuals with skin integrity issues. The multiple pressure points with mesh fabric in combination with the heat and moisture of bathing may irritate skin. The quilted mesh slings have a mesh body and quilted leg bands. The leg bands are a combination of open cell foam and polyester material which provides both comfort and durability. Quilted mesh slings are water and air permeable, and the quilted leg bands reduce the bunching effect under the thighs sometimes seen with all mesh slings. The polyester mesh, also known as a mesh poly sling, is a combination of mesh fabric on the body of the sling and a smooth, comfortable polyester layer with non-absorbent padding on the inner leg bands of the sling. This fabric reduces the bunching effect under the thighs and may be suitable for bathing needs. Poly slip slings are constructed of polyester and slip fit fabric. These slings are made of a durable, breathable, smooth knitted polyester fabric which can stretch, providing added resident comfort, and the outer leg sections are constructed of a slip fit fabric, a low friction nylon fabric which allows the leg bands to be easily fitted. The spacer fabric slings are constructed of a comfortable and smooth knitted polyester. This fabric is both air and water permeable and may be an option for bathing. This fabric has a slight stretch in all directions to allow the fabric to mold to the individual's body. The disposable fabric, typically seen in institutions for infection control, are designed for single patient use. This non-woven polyester sling material is strong, breathable, and liquid repellent. It can only be spot cleaned and discarded when heavily soiled. This handy resource can be added to your facility training toolkit to help caregivers learn about fabric options. Now let's see if the sling we have chosen fits the resident. Once a sling style, size, and fabric has been selected, check and ensure the sling is a good fit for the resident. Here's an example of a universal sling fitting. Ensure that the sling is both supportive and comfortable. To ensure a good fit, begin by folding the sling in half to locate the center arch. Use this point to landmark. Place this at the resident's coccyx. The sling's midline is placed along the resident's spine. Once the sling is placed behind the resident, locate the shoulder straps. The shoulder straps should generally fall between the top of the resident's shoulders and the bottom of the ears. If the straps are too high, check to ensure that the sling has not been placed at the low or mid back. If the straps are too low, check and make sure the sling has not been placed under the buttocks. Now let's check the lateral borders of the sling. Are the borders equally spaced on both sides? If not, readjust the sling. Ensure there is enough support for the resident laterally for a supportive fit. Check, are the leg bands equal on both sides? If not, check that the sling has been properly landmarked. When the leg bands have been applied under the thighs, ensure that you have at least 3 to 4 inches of fabric on the inside of the thighs to prevent the straps from irritating the skin. Ensure the leg bands are supporting the resident under the thighs and that the leg bands are flat and not bunched up. Once the leg bands have been applied, whether crisscrossed, open, or in a closed format based on the resident's assessment, the sling straps will need to be applied to the carry bar. Once the resident is lifted off the surface prior to the actual lift and transfer, check and ensure that the resident is not migrating through the commode opening and that the resident is well supported and comfortable in the sling. Once the sling size fitting has been completed with the resident, the information can be documented and communicated with staff. On screen is a sample of a universal sling fitting tool. It's an easy to complete form that can be used for staff training or can be used to communicate resident sling needs with staff. Feel free to add this handy resource to your staff training toolkit. Post-sling selection, a pre-use sling inspection is needed. Prior to each resident lift and transfer, the sling inspection must be completed. On screen is a sample of a pre-use sling inspection checklist. Once you have completed the inspection of the sling and lift equipment and decided that they are safe to use, you can initiate the sling application process. If the sling does not pass your inspection, the sling should not be used and discarded as per your facility policy and procedures. These handy resources can be added to your training toolkit to coach caregivers on sling inspection and how to discard slings that are not usable. As part of the sling pre-use inspection, ensuring you have a clean sling on hand for the resident to prevent cross-contamination is essential. Handicare recommends laundering slings that are reusable. Sling laundry instructions can be found on the sling label, in user manuals, online, or if you have specific questions regarding laundry, feel free to contact us. On screen is a sample of the laundry instructions for the universal sling. Feel free to add it to the toolkit to teach caregivers about caring for slings. With regards to infection control strategies, to manage and control for cross-contamination between users, some facilities have chosen to utilize disposable slings. There are a variety of disposable slings available to meet the needs of residents and caregivers. These slings are single patient use slings, meaning they are only to be used and isolated to one individual. These slings are not laundered, thereby not coming into contact with other slings or personnel in the laundry process. Rather, they are spot cleaned when needed and discarded when heavily soiled. Disposable slings may also prove to be beneficial, not only as a means to manage cross-contamination, but they may also prove to be easier to store and may reduce the cost of slings that may be lost during the laundry process. Next up, sling application tips and tricks. There are many ways to apply a sling. If you require assistance, please feel free to reach out to us at Handicare to assist you in finding a solution to your sling application needs. To apply a sling or to teach sling application, begin by breaking down the process into 5 basic steps. Step 1, as we discussed earlier, is to perform a pre-use sling inspection. There are several ways to lean the resident forward to apply the body of the sling. Here are a few examples. If the resident is able to safely assist, have them lean forward and then apply the sling. If the resident requires assistance, You could try rolling the sling up and using it to lean them forward. If the resident is unable to lean forward for various reasons, do not force them forward. This can cause injuries to both the resident and caregiver. If the resident is not able to lean forward, you could try the Easy Glide ovals both in a supine or seated position to apply slings. Let's have a look. Or another option may be to assess if a leave-in-place sling, like the Comfort Care sling, is appropriate if you are unable to apply and remove the resident sling. Next, straighten the leg bands and ensure they are equal and level on both sides. To slide the leg bands under the resident's thighs, first check if the resident is able to safely assist. Are they able to raise the knees up by either going up on their toes or by using their hands to lift the leg up? This will make it easier for the caregiver to apply the leg band under the elevated thighs. Or try a footstool under the feet to raise the knees up to provide more space for the leg band application. Remember to remove the footstool when the leg band application has been completed so it does not become a tripping hazard. If the resident cannot assist with raising the knees up, we could try using the Easy Glide ovals. Let's have a look at this leg band application using the Easy Glide ovals. Next, apply the straps and loops to the carry bar. The selection of straps and loops will be determined by the resident's needs and abilities. The various strap and loop options enable the caregiver to position the resident in a seated to a more reclined position. Once the sling has been applied, ensure the resident has head support if needed. Ensure the lateral borders are providing enough support. Ensure the leg bands are flat and not bunching. Ensure straps and loops have all been applied and are not caught in the wheels, brakes, or under the armrests of the chair. When you raise the resident off the surface before the transfer with tension on the straps and loops, ensure the straps and loops have all been properly applied and are not migrating off the carry bar. Ensure the resident is not migrating through the commode opening, and ensure the resident is well supported and comfortable and safe in the sling. Now you're ready to begin the lift and transfer. For further assistance with sling application, sling user manuals are available on the Handicare website. Add it to the toolkit. Lastly, don't forget to add a sling to your toolkit that can be used specifically for training purposes. Now you're set to cross-train staff in safe client handling. We hope you found the session helpful. Now let's check in and let us know via the chat window, on a scale of 0 to 5, how comfortable are you with slings? Please feel free to reach out to us at HandyCare with your questions or comments. We're more than happy to assist you, because at HandyCare we strive to make everyday life easier. Thank you for attending our session on cross-training of staff in safe client handling. Lastly, here's a new Sling resource to help you with your resident Sling needs. Please feel free to reach out to your account manager to obtain a copy. We look forward to seeing and hearing from you soon. Take care and be well.